And a special day for us here in Uganda as we receive the first consignment of COVID-19 vaccines from the Serum Institute of India under the COVAX facility and aboard the Emirates Airlines, as we all saw. So I request all of you to appreciate God for this wonderful day. In a special way, allow me to appreciate the people who work tirelessly, and I'm not going to mention names because I may forget someone, to ensure that the vaccines arrive here and arrive on time. For the vaccines to get here, Uganda had to complete some requirements, and one of them was to ensure that we have a national vaccine deployment plan, which we do have. It was completed and approved. The second was to sign an indemnity agreement with the Serum Institute of India. It was done and approved. And the third was to ensure that the National Drug Authority, that is ably represented here, approves the vaccine for use in Uganda. And it is duly approved, and Uganda can therefore use the vaccine to vaccinate the community. So allow me to say a big thank you again to all of you. So the vaccines will be used to vaccinate persons providing essential services and who are at high risk of exposure in the line of duty. The groups will be vaccinated with the doses at hand, and these groups include the health workers in public, private not-for-profit, and private facilities. It also includes the security personnel, the UPDF, police and prisons, and it includes the teachers in the public and private facilities. Uganda is fully prepared to launch and start utilizing the vaccines starting on the 10th of March 2021. We will use our tested strength of decentralized health services to deliver the vaccines to the target populations in a record time. We have adequate cold chain capacity that has been prepared to receive the COVID vaccines at the national medical stores that is also represented here and also at the district level. The vaccines have been allocated to the districts, and the national medical stores will deliver to the districts on schedule. District teams have been trained to safely administer the vaccines to the target populations. Registration of priority groups has been finalized, especially those that we have highlighted. So I expect all the districts to start vaccination of health workers following the launch on the 10th. The initial groups will be the health workers in the public health facilities, followed by those in the private not-for-profit, and then subsequently those in the private health facilities. And this will be done between the 10th to the 15th of March 2021. Thereafter, we shall have the teachers, and the exercise will begin from the 16th to the 19th of March 2021. Our official launch will take place on the 10th and not on the 8th as initially communicated, because as many of you are aware, the 8th is International Women's Day. So our launch will take place at Mulago National Referral Hospital, and you will have a few of these people here vaccinated as well. So we invite you to come and be present at the launch. This is just the beginning of our journey to vaccinate an estimated 22 million persons against COVID-19, including the refugee populations. Further information on the vaccination schedules for the rest of the population will be provided from time to time as we receive more vaccines. The government of Uganda appreciates the commitment of the global community, here represented by the excellencies, the ambassadors, the high commissioners, and the UN fraternity, for mobilizing resources that enable this unprecedented research, development, and production of vaccines in record time. We are indeed grateful for the establishment of the COVAX facility, a mechanism put in place to ensure equitable allocation and distribution of the otherwise very scarce and expensive COVID-19 vaccines free of charge to low and middle-income countries at a time when the whole world is experiencing one of the worst economic hardships. We want to appreciate His Excellency, the President of the Republic of Uganda, who spearheaded the COVID-19 response and also provided this very conducive environment for us to have the vaccines here on time. As we receive this first consignment of vaccines, we shall continue to encourage every Ugandan to patiently wait for their turn to receive the vaccines while we remain vigilant and working very hard with the COVID committee members. So
with the vaccines arriving today, we do expect that the change is going to happen. The return to a new normal that would allow the economy to flourish again. We do look for the full vaccination of all the people who are on the front line, helping us, defending us, and protecting us against the virus.
The quick spread of this horrible disease from country to country showed how interconnected we all are. And the strong presence here today from the Ugandan government and the international community reinforces that a global challenge like COVID-19 requires a global response. That is why we're here today in a spirit of cooperation, working together with Uganda and international partners.